Do you talk to your healthcare provider? You should. Hello and welcome to 18 WJTS in.form. Joining us in the studio is the Purdue Extension Educator for Du Bois County. That is Jan Dougan. Jan, welcome to the show.
Thanks, Bill. It's just so great to be here. We really appreciate the opportunity to come and be on in.form and share with those viewing information that can help them to live well.
Well, we always appreciate you coming in because there is always something that you say that somebody can take home, so to speak, and use in their life. And one of those things we're going to talk about is talking to your healthcare provider. Are we talking specifically about doctors, or is it the nurse, or just whoever is?
Well, I think that people need to be empowered to talk to all their healthcare professionals. Today, when you think about healthcare, people don't just talk to a physician. They may talk to a family nurse practitioner, they may talk to a dietitian, they may talk to a nurse, they may talk to a healthcare advocate, they may talk to a pharmacist. And that's just to name a few of the people that might be on your healthcare team, depending upon your particular situation and your state of health and well-being.
Are people afraid to talk to their healthcare provider?
I think maybe there is some fear that is associated with that. I think there's some tradition, the culture of health today, depending upon how old someone is, their generation, what they have, their past experiences. I think that there's a combination of things going on here, but what we want people to understand is that as our healthcare system changes in our country, people are going to have to be advocates for their health and well-being. The physician is there, he's part of the team. You're part of the team. The nurse is part of the team. The pharmacist is part of the team. If you consult with a dietitian, she or he is part of your team. So it takes an effort for this whole team to come together and understand what's going on, and for you to have a clear understanding of what they're talking to you about. So it's important to ask questions.
And Purdue Extension helps you to do that.
Well, we have partnered, Purdue Extension has partnered with the College of Nursing on Purdue's campus to create some Aging Well publications that are available as a download. So if you go to our website and you're looking for information on aging well, you could put that into the search box and these publications would pop up. Or you can just give me a call at the Extension office, 812-482-1782, and I'll be glad to share this information with you. But one of the new publications is How to Talk to Your Healthcare Provider. And it's got some great tips for before you visit the doctor, during your visit to the doctor, and after you visit the doctor. Things that you need to know.
And sometimes the things are not necessarily life or death, or they could be, but just more for your well-being as well, to use the advice that the doctor gives you better. What are some things you should ask the doctor?
So I think before going to the doctor, one of the key things is to write down questions that you've had, or write down symptoms that you've had, or write down when something happens, this is how I feel. Write that down, because sometimes when we get into the situation where we're in the office and we have to wait a while, and then we get in and we feel like we don't want to take any more time or energy away from the physician or the healthcare provider that we're talking to, we might forget to ask those questions. But if we have it written down, if we write it down, then before we leave that visit, we need to have the answer to those questions that we had before we went. And sometimes our memories aren't so great. So we get into that situation and we forget what question that we had. But if it's written down, we're going to remember. The other thing is, I think that it's really important before your visit to see if there's someone that you have confidence in that you can go to the appointment with. So take someone along with you. Because I think that, especially in our aging population, as people age and they might have a hearing issue, so maybe something that the physician or the healthcare provider says to them, maybe they just don't hear it, or maybe they don't understand what was said, or sometimes we want to interpret what we hear as what we want to hear, right?
Right.
So, you know, if a doctor or a physician or the nurse practitioner says to you, well, you're a little overweight. Did they tell me to do anything about that? And I just heard, well, I'm a little overweight. A little overweight isn't so bad, right? Mm-hmm. So, you know, we interpret what we hear sometimes how we want to hear it. So we need to ask for clarification. We need to make sure that we understand what they're saying to us. So a really good technique for people to use when they're at the visit is if a doctor says to you, I want you to take this medication 3 times a day. How would you interpret that?
Well, I take 3 pills, once in the morning, once in the afternoon, once at night.
Okay, so that might mean what they want you to do, but to ask the prescriber that would be important. So to say back to them, so do you want me to take this medication when I eat breakfast, when I eat dinner, and when I eat supper? Then you would have a clear understanding of what 3 times a day meant. You could also ask your pharmacist that when you go to get the prescription for clarification on that. But to ask for clarification and clear understanding. And you know what? It's also okay to say, you know what? I don't really understand or get what you just said to me. Can you use some other words to tell me so I can understand? Mm-hmm. Because sometimes, you know, medical terms are used that we don't understand. So, you know, I want to give permission to everyone to ask your questions, to ask for clarification.
You're nervous anyway.
Sure.
And
sure.
So oftentimes you don't, and you feel the doctor is in a hurry, mm-hmm. And you don't want to take up their time, but you need to. And mm-hmm. sometimes even the what you may think of as an inconsequential question can mm-hmm. be very important.
Yes. You know, you can also ask during your visit, can you write that down for me? Or do you have a handout that you can give me that I can read more about it? Because what else do people do after they go to the physician and they learn about a diagnosis or they learn about something? A lot of people turn to the internet, mm-hmm. right? Mm-hmm. To try to do their own research. And they might not be searching the right sites. They might not be searching reliable resource-based sites. So, you know, it's really important to try to get that information from your physician. I also think that, you know, again, at your visit, if there's something they're asking you to do, repeat that back to them so that you can demonstrate that you have understanding of what you're supposed to do. And then when you have that other person in the room with you, they're hearing the same thing too. So when you get back home and you say, well, I think the doctor said, or I think the physician told me this, the other person that heard what was said can say, I heard this, you know. So it just helps with clarification.
Now, after your doctor's appointment.
Yes, after. After. If you have any questions when you get home afterwards, call him back. Call him back. You might not be able to talk to the physician directly, but you could talk to the nurse. Most of them have a nurse that you can talk and ask your question then. You can also afterwards talk to a pharmacist. Even those who have programs that they have to order their medications online, there's still a number that you can call to ask questions and get information. So it's just really important to empower yourself to ask questions. And if you don't understand something, that's okay. But you need to ask the questions so that you do understand, because we want you to be responsible and we want to empower you to take care of yourself.
I think, you know, writing the questions down before you go in is a great idea, because mm-hmm. when you get in there with a doctor, he may say something or she may say something that really scares you or and then you forget all your questions, and you're not really listening to what they're saying because your mind is in the wrong place. You know, write it down to bring yourself back on focus too.
Yes, that's a great idea. And you know, if you feel uncomfortable asking the question, that person that goes with you, whether it's a caregiver or a family member or whatever, share with them what questions you have when you're going to be at the physician's appointment. Because if you feel uncomfortable asking it, or if you feel uncomfortable saying it, that person may be able to say it for you and be your voice at the office visit. I know when I had an elder parent that I would take to the doctor, we would talk ahead of time about his questions, what he wanted to know, what he needed to tell the doctor, and then I noticed that when we got into the appointment, he wasn't always sharing all that information. So, you know, when that physician always says, well, is there anything else I need to know? That was my opportunity to say, I think there's a couple other things we want to share with you that maybe we've just forgotten to say up until this point. So I think the combination, like you said, of writing it down, your questions, and having that other person with you will help you have a better visit to your healthcare provider.
So it's important to talk with and ask questions when you go to your healthcare provider.
Right.
Jan, thank you very much for coming in.
Well, thank you.
And we thank you for watching. Our guest has been Jan Dougan. She is the Extension Educator with Purdue Extension in Du Bois County. We are WJTS, local people watching local people.